Welcome to episode 10 of For the Good of Man podcast, your trusted source for all things men's health. In this month's episode, we're thrilled to welcome Raquel Nader, a board-certified nurse practitioner with Liquivita, who is experienced in weight loss and sustainable health solutions. Together, we'll explore the journey to achieving and maintaining a healthy weight while discussing practical strategies that go beyond short-term diets. Raquel will provide insights into the latest advances in medical weight loss, including the role of popular weight loss medications like GLP-1s, the importance of personalized nutrition, and how to create a lifestyle that supports lasting results. We'll also discuss the emotional and mental aspects of weight loss and tips for overcoming these common hurdles. Whether you're just starting your weight loss journey or looking to break through a plateau, this episode is packed with expert advice and actionable tips to help you transform your health and reach your goals. So grab a seat and join us as Raquel Nader shares her expertise on building a healthier, happier you.
So how do we define obesity? So many people just try to figure out, what does that really mean? What does that entail? Is it my BMI? Is it my weight? Is it the way that I look in my clothes? So based on this screen here, you can see that the body mass index over someone of the age of over 25 of a BMI is considered overweight. The BMI of over 30 is considered obesity. And then once you hit BMIs over 40, now that's severe obesity. In the United States, nearly 1 in 3 adults, as you can see, is 30.7% are overweight. That is an extremely high number. More than 2 in 5 adults, which is 42.4%, have obesity issues. And about 1 in 11 adults, which is 9.2%, have severe obesity. This is a definite issue that's going on in our country, and that's why we're here to make a difference. So let's see what the next slide says. So this is the prevalence. We just wanted to give you like a graph on how over the last 9, 10, 15 years on what the obesity numbers have been looking like in adults. This doesn't even include children as well. This just mainly focuses on adults since 2011 to 2022. The studies haven't included the last 3 years up to 2025, but you can see this climb is just, it's enormous. That's why we really need to take control of our diet, exercise, and just our overall mental wellness when it comes to what we're putting in our bodies. And that's not just what you're consuming mentally, but also what you're consuming physically as well. Causes and symptoms of excess weight. This is a great question. What raises the risk of obesity? Obviously, we know that when you live a sedentary lifestyle, which is lack of physical activity, unhealthy eating habits, unbalanced diet, lack of quality sleep. This is a big one. Most people think, well, maybe I can just run on very low hours of sleep and still be able to lose weight. That is definitely to the contrary. You really need really good rest. And we're talking about adequate rest at night. When you wake up and you feel like you slept all night, that is considered adequate sleep. Health conditions, comorbidities like diabetes, high blood pressure, high cholesterol. These things are all part of that as well. Hormonal imbalances, another big one. As we age, our hormones are just all out of whack. We're wondering why we're doing all these diets and exercising and nothing seems to be helping. And that's, a lot of it has to do with your hormonal imbalances as well. Certain medications, that's another big one. A lot of us are on certain things that we think may be helping our bodies and it's actually causing harm. And then our environment could be people, places that we go to. Environment plays a key role in how we care for ourselves. Anything that's in your immediate environment, it's almost like it subconsciously changes the way that you operate and do things on a normal basis, okay? And as you can see, 1 in 3 adults in the US is overweight. Those who are overweight or obese commonly experience these. You may actually resonate with some of these signs and symptoms. So breathlessness, daytime sleepiness, I'm guilty of that one. Dizziness, fatigue, headaches, heavy sweating at rest for like no reason at all, joint and back pain, and psychological symptoms, low confidence and self-esteem, feeling isolated, increased anxiety and depression, disordered eating patterns are another thing where you feel like I'm going to binge eat because I'm feeling sad or depressed. and then 1 minute you're so stressed that you can't even eat. That's exactly what they're trying to explain there. Weight loss. When should someone consider losing weight? This is a big one because a lot of us don't know. We get told that we look a little plumpy sometimes by family members, or you look too skinny, which is another one. You just never know when. So things to consider: obesity and being overweight. As we saw that the BMI over 25 is being overweight, and then obesity comes into the BMI of over 30, right? Type 2 diabetes, that's a big one. Cardiovascular disease, joint and mobility issues. If you're noticing that you're not able to be as active in certain areas of your life, then you may consider that you need to start losing some weight for healthy and longevity of life. Sleep apnea, this is a big one. That belly, that big circumference of the abdomen, is pressing down when you're sleeping to the point that you're stopping breathing. That is dangerous, okay? Certain cancers, metabolic syndrome, psychological and emotional issues. This is a, what do they call that? It is the unseen disease, okay? Because you don't want to talk about it doesn't mean that you're not going through it. Hormonal imbalances, which we already discussed earlier. Family history of obesity related conditions. Just because you have obesity or overweight family members doesn't mean that you just have to settle with being overweight or being obese. Erectile or other sexual dysfunctions, men and women also experience as well. It's not just men and it's not just women. Women planning to conceive, and so much more. Nutrition for weight loss. This is such a big topic because most people think, well, maybe if I just do a little exercising and cut back on this, then I won't really need to make sure that I'm watching what I'm eating. Your nutrition is an everyday thing that you should incorporate in what you are mindful in putting into your body. It's not just, I'm going to go on this diet and then on the weekends I can, have fast food, which we all fall into that. So we're all guilty of that. You want to prevent chronic diseases, and this all comes around inflammation, and that has to do with your diet and your nutrition. Improved quality and concerns, again, this is just repetitive: the mobility, sexual health, pain, mental well-being. All right, set 3 objective goals and progress at your own pace. Now, it has to be at your own pace. We're not expecting you to just take everything all out at once, because when you take things out all at once, it becomes too much, and then you fall back into that complacency mindset. So just take things like avoid or limit liquid sugars, right? The Coca-Cola, the drinks, the sweet fruit drinks. Those have so much high fructose sugar in them. They also have added sugar, which most people don't even pay attention to that as well. Also added salts, frozen foods, processed meats, lunch meats, things like that. You can get low sodium lunch meat if you're going to go that route. And trans fats like fried foods. A lot of chips are trans fats. So we want to take care of that as well. Exercise for weight loss. Exercise is fun. Most of us don't think that when we're first starting out, but if you can incorporate that into making it, you know what, this is a promise that I'm going to make to myself. I'm going to get in that gym every day. It'll actually help for you to be more consistent. So exercise and diet is not the only tool for weight loss. Can you believe that? Exercise, however, offers additional health benefits. It improves heart and lung function, bone density, muscle mass, right? So you don't want to lose that muscle. You want to still keep the legs looking nice and fit, and your bottom portion of half of your body. You don't want the flabby skin. Mental and emotional well-being. You reduce so much stress when you work out, believe it or not. Reduction in blood sugars. If you're, having diabetes issues, improves fatty liver. Most Americans, mostly anyone that is overweight or obese, has fatty liver disease. Okay, and that's where you start to see that increased circumference of the abdomen. Exercise, particularly resistance training, helps you maintain your weight loss by helping you to preserve as much muscle as possible as you continue to lose weight. Muscle is key when you are with your longevity as you continue to age. When you age, you don't want to get into something called frailty. Frailty is a physiological disease that you can't even hold yourself up. You're so weak that you can't even hold your own body weight. A lot of us are more health conscious as we're starting to age. We have so much information out there that we're reading, and what is real, what is not, right? Anything that has to do with longevity that's going to keep you nice and healthy and able to still maintain your physical health. You can go on vacation and not feel like you're so tired. You want to sleep the whole time that you're there. You're actually able to do some physical activity. That is the longevity that we're talking about. Okay. Goals for physical activity are 2.5 hours total per week. You want to mix that with cardio and resistance training with weights. Weight training is great with keeping that muscle mass going and keeping you nice and strong. Medical interventions for weight loss. That's a big one. We all have been hearing about that, right? That thing where it says emotional well-being. When I was overweight, I was almost 300 pounds. And I am now down 126 pounds in the last 2 years. And I've been able to keep it off with diet, exercise, and the modalities that we offer here at Liquid Vita. I would not post pictures online. Even with my daughter, I would take pictures with her and it's just in my phone. And I was just so ashamed because I didn't want anyone to see how big I got. And that was something that psychologically played mind games on me, because the only person that I was really hiding from was myself. I had to live in this body. I knew that by getting that butter pecan tub of ice cream, which is my favorite. If anybody wants to buy me a tub of ice cream, you're more than willing to. I knew that by me eating that late at night, that was not going to help me. So just to let you know, there's somebody out there that understands, okay, but you can do it. So who can prescribe medical weight loss, right? And you see this everywhere, all these weight loss clinics. You want to make sure that you are going to a licensed provider, okay? Doctors, okay, MDs, all right, DOs, which are doctors of osteopathic medicine, physician's assistants, nurse practitioners like myself, or even doctors or providers, nurse practitioners, PAs that work in urgent care centers. You want to make sure that they credential themselves. Just like in the beginning of this video, I credentialed myself. I said my name and I told you what my credentials are. Nurse practitioner, board certified. You want to make sure that the person is not just working at a med spa where you see a lot of these, inflation of diet clinics. Who do you know that you're getting these injections by? Who do you know is really prescribing this? How do you know that the stuff that you're getting is what is approved in these compound pharmacies and are safe for you, right? You want to make a change, but you also want to do it safely. All right, medical interventions for weight loss, my favorite, all right? This is key. We all need a tool to help us get to our end goal, right? And the end goal is weight loss, but it's also longevity, health, wellness. You want to feel good. You want to put those clothes on and look at yourself in the mirror and just have this confidence, right? And know that you're healthy, not just slim, right? Because everyone thinks that slim means healthy. That's not what that means. Overall, right? The holistic that I was talking about earlier. So medical interventions for weight loss may include prescription drugs, which we'll get to that in a moment. Behavior modification. Remember I talked about that mindset shift that you have to do, because you will go through imposter syndrome, which I also faced that as well, and so did my colleague Jessica that you saw on that slide, our before and after photos. You have to get used to who this new person is, right? You got this new body, so that mindset shift is key. Medically supervised meal replacements. You need a coach, okay? You need a medical provider that is following you all the way, because you see a lot of people that get on some of these weight loss medications and they're not followed by a licensed healthcare provider that can give them the proper tools and the proper modifications as they continue to progress and improve in their weight loss and overall health, okay? Important reminders. When choosing a weight loss strategy, a healthcare professional will consider your health history, right? Because that's big. We got to know that. And possible side effects. Certain weight loss strategies may not work for everyone, right? And we know that, but that's what it takes, a licensed healthcare provider and a coach to take you on that journey and what's best for you, okay? And the effects of over time when it wears off, right? What tools can you use then as well? Because you don't want to stay on these forever, but it is a tool, right? You guys are going to do great. I know it. Important reminders. Good to consider to always work with a wellness coordinator, which is a healthcare provider, to help ensure your accountability during the weight loss journey. Listen, that big word there, that accountability, huge, because you're going to be around family sometimes that will not hold you accountable, right? You're going to have friends, you know, they're going to want to eat certain things or do certain things, but you know what your goals are, you know what your plan is, and that's where your providers come in to keep you accountable. And you'll start to keep yourself accountable because you're doing this more on a consistent basis. GLP-1. GLP-1s are the most common. The ones that we hear about are semaglutide. Semaglutide is Ozempic and Wegovy. Semaglutide is the generic name for it. Ozempic and Wegovy is the brand name. That is the brand of the medication, but semaglutide is the generic name brand for it, okay? Because I'm sure you're probably confused on all these different names. I just wanted to clarify that. Then we have tirzepatide, which is Mounjaro or Zepbound, okay? These are all injectables where these are assisting tools to help you to lose weight, okay? How does it work? GLP-1 agonists work by modulating insulin release from the pancreas, transferring sugar from the blood into the organs, where it can be processed into energy for the body to use. We need to use the proper sugar, right? And we need our insulin to spike, not continuously spike. That's called insulin resistance, right? Because your insulin is not working properly, it has a resistance stage where your body is holding on to that blood sugar, right? And you're not able to use that for energy. And that's why you are holding on to so much fat and gaining weight, right? And where we mostly see that with insulin resistance is the increased abdominal circumference, right? You noticing, why is my belly looking so big? You know, why is I'm looking so swollen, right? And it's because of that reason. All right, and this is where the GLP-1s come in. Tirzepatide, what's the difference between tirzepatide and semaglutide? Big question. Tirzepatide is a dual agonist, meaning that it works on insulin and it works on other hormones to help you to assist losing weight. Synergistic means that it's working in a dual way, right, to help you to lose weight. Now, semaglutide is a single agonist, only targeting one of those glucagon peptides receptors. They both are great with kidney protection, cardiovascular protective, and overall to help bring down that blood sugar in a healthy way, get that insulin to increase to help you burn off that blood sugar. That's also going to help you in turn use that blood sugar as energy so that you can start to burn fat. All right, amazing drug. It's going to help you to do so many wonderful things and be used as a tool to get to your weight loss goals. Okay, how is it administered? It is administered subcutaneously. Okay, subcutaneous means into the fat, right? The preferable place to do that is in the abdomen. Now, when you're injecting, you're going to want to rotate sites. We're going to do a demonstration so you can see exactly how that is done. We're going to use a lovely model here that's going to show you exactly on a live person, what does it look like to actually pinch the skin, inject, what is the actual depth? What is the actual, the angle of the needle, right? Because so many people are afraid. They're like, well, I don't work in healthcare. How do I know how to inject? Well, that's what we're going to show you right now. Okay, next slide. All right, so semaglutide concentrations. Our compound pharmacies, they use B12. You're looking at this big word, cyclocobalamin. I can't even pronounce it either, and I'm a healthcare provider. It's just B12, right? B12, as you know, it helps to increase that energy as well, and it helps to boost your immune system. So think about it. If you're getting something that's helping to assist with weight loss and get increased energy, it's a win-win, right? You're going to start to feel better. You're going to start to feel like, you know what, I do have the energy to go and work out now, right? It also helps with hunger. And we're going to talk about that in the other slides as well, right? We also have oral semaglutide, right? Doesn't work as effective, but you do have other options, right? And then tirzepatide is also another injectable, all right? And these are just some dose ranges that you can see like on the right-hand corner here. That is going to be dependent on your height, weight, and the dosing that we come up with, because it's going to have to be independent to you. Okay, so next slide. Needle and syringe. I know this looks so intimidating when you see a needle. I want to show you guys something here. Just going to show you the needle, what this looks like. It is an insulin syringe. Okay, a lot of you don't know what an insulin syringe looks like, so I'm going to show it to you. It's extremely tiny. Don't be intimidated by the long portion of it. That's just called the syringe itself. See, with the numbers on it, that's just the syringe. This, you pop this baby off right here. This is the plunger that's going to help to assist the medication that is going to be drawn up into the actual syringe. Okay, this is the cap. You never recap, because then you can stick yourself with the needle. Okay, and we'll talk about that afterward. But I want you to take a look here. Whatever your dosage is going to be, right? This needle is what's going to go inside you. So you're not going to want to, touch that or anything like that. You want to keep that as clean as possible, all right? When you draw up, the medication goes in this little syringe, and I'm going to show you when I inject into Jessica exactly what that looks like. So as soon as you inject in, this plunger goes in. There should be nothing left inside this syringe. If there is, that means that you didn't get all the medication in. You should not be taking that needle out of your skin until you have injected all the medication in. All right, guys? So that's what this looks like. It's not that as intimidating anymore, right? I hope not. See? I'm going to put that over here. And that's exactly what you see on the slide here, all right? Is the exact same size of that syringe with the needle on it, all right? The syringe is a plastic part, which is that one with the numbers on it, that's plastic. And then obviously the pointed end is where the needle is, and that's what's going to be inserted into the body, all right? The subcutaneous tissue that I was talking about. And the actual size in milliliters, it's just 1 ml, which means 1 cc of fluid. You guys don't know what that is, but we just want to at least just give you what those numbers look like. Education is key here, okay? Next slide. Okay. There we go. All right, usage and dosage, all right? Commonly asked questions. A weekly injection is administered in the abdomen. That is what's the dosage is going to be for this medication. So whatever you draw up, you're going to give that to yourself weekly into the subcutaneous tissue that we spoke about. The length of the treatment plan varies from person to person, but most lasts about 8 to 16 weeks. There's something that we talk about when it comes to our clients. We like to microdose. You should never abruptly stop taking any medications, okay? So we like to continue that journey, and this is why you do need a healthcare provider like myself or someone on our team that's going to help assist you as you continue on your journey, because just stopping this, we don't want that rebound to happen, right? So you want your body to consistently just come down until it is at a nice baseline, and then we'll help you and assist you as you continue to go and give you more tools, okay? So common side effects of GLP-1 is nausea, vomiting, diarrhea, okay? Avoid strong smells, eat crackers sometimes if you're feeling a little nauseous. Ginger-based foods like ginger tea is actually helpful. Drinking more water helps with constipation, believe it or not. And eating foods that are high in fiber, like vegetables. Vegetables are a nice, beautiful, natural fiber content of food that you want to be consuming on a daily basis. It is going to change your taste buds. So the things that you normally would like to eat before, like certain sweets, certain salty foods, you're going to notice that you don't actually crave those things. And that's how the GLP-1s work. They're excellent when it comes to how the mind and gut work. And that's exactly where they work. The mind and gut, they actually have a very close relationship. So it sends signals to that brain, and it's telling you that you're hungry, but you're actually not really hungry. And then your brain sends signals to your stomach, and it releases these little hormones that tells your stomach that you're hungry. And this is why that brain to gut mind connection needs to be nice and fused synergistically together. And that's where the GLP-1s come in, okay? Most common side effects, like we said, nausea, acid reflux, bloating, and constipation, because again, you're not eating as much as you were eating before. GLP-1s cause a little bit of these digestive enzymes to just control and slow gastric emptying, meaning that you're not, those hormones that make you hungry, those are actually kept at a minimum. So if you're not putting much food in there, what do you have? Gas, right? You're not putting much food in there, you're going to have constipation. So that's why it's key that you always stay hydrated. If you're someone that does not like to drink a lot of water, you got to put an alarm on your phone to just remind you that you need to drink water. Okay. Eat bland foods, low fat. Don't lie down after eating, because that's going to help to minimize some of that acid reflux. Eat slower, because you're going to feel a little nauseous, right? Eat smaller portions. Remember, your new body cannot sustain the amount of food that you were eating before, right? The imposter syndrome. So just slow down. If you feel full, stop. That means that is the size of your new stomach now, right? So that's what we mean by that mindset shift. So how long will I be on this medication for, right? This is the big topic. So every patient's needs are different, right? And just like we just discussed earlier, 8 to 16 weeks is usually the mark of where we try to keep our clients. We don't want to keep you on forever, right? A tool is to be used temporarily, not forever, not permanently, right? So working along with the healthcare providers, we ensure that you reach your goals. Once you reach your goals, then it's going to be determined how you're doing, and based on your weight, how you're feeling in your clothes, the feedback on side effects, that's when we start to bump down, right? We do a measurement of your waist circumference, and just targeted areas of your body that are important to show like the journey and the difference in weight loss, and especially the waist circumference. That's a big one, right? Then we will start to come down on the dose. What we've been finding that's been very helpful is microdosing, right? As we get you to your goal, we start to microdose. Micro just means a small, tiny dose, just to keep you at that nice maintenance, right? Because we don't want you to just stop. Once you become at that goal, you feel great, you feel improved, then we will see and reevaluate to see if you're even a candidate to come off, okay? So again, like I said, it's a tool, it's not to be used forever. We decide to taper down, like I said, each month on the dose, and we spread out each injection maybe every 2 weeks instead of every week. That's what we mean by microdosing, okay? Key points for GLP-1s. Number one, weight loss, right? That's what everybody wants, right? But that's also going to lead into health and wellness. Gets you feeling fuller sooner. I don't know how many of us feel like that is one of our goals. Like we want to eat and not feel like we're not full. I mean, that we are full. We eat so much and then we get hungry again. You want to feel full. You don't want to feel like you're overeating, right? Suppresses your appetite. You don't want to feel like you're eating too much, and just making sure you're eating just enough just to sustain your new healthy body. Improved energy, increased confidence, like we were talking about. You want to wear your clothes and feel good in it. You want to look in the mirror and say, wow, I'm actually fitting in those jeans that I haven't worn in years, right? Reducing the cravings. I know we have these just insatiable cravings. You can still have the things that you love to eat that make you feel good, but you should not be eating it in excess. Medical interventions that can be safe and effective way to lose weight, and that's the GLP-1s. And always consult with your healthcare professional before starting or changing a medical weight loss plan. You do not want to stop. You do not want to increase any of your dosing or come down on your dosing without coming and speaking to your healthcare provider, because we are the ones that's coming along with you with this journey, and we're keeping you accountable, right? So that's going to be our relationship moving forward.
Thank you so much for listening to this episode of For the Good of Man podcast. We hope you found Raquel Nader's insight on weight loss and lasting solutions inspiring and empowering. And remember, if you have any questions you'd like us to answer in a future episode, feel free to submit these at menmd.com/podcast. Don't forget to tune in next month, where we'll continue the conversation and dive deeper into overall health and well-being. Until then, please take care, and remember, it's never too late to take the first step toward a new you.